going to talk about Dr. Anthony Fauci a little bit. In fact, we're going to talk about what I call Fauci's 5 fatal pandemic errors. These errors were contact tracing, failing to protect the vulnerable, closing the schools, ignoring natural immunity, and the last one, and the big one, funding Chinese labs. So let's start with contact tracing. Many people don't know that Anthony Fauci wasted a couple of million man-hours and tens of millions of dollars setting up contact tracing groups across the country. What is contact tracing? Well, contact tracing means that you try to track down every last case of COVID, and then you try to track down every last person who came in close contact with someone who had COVID, who was within, 5 or 10 feet of that person for more than a couple of minutes. And then you try to isolate all of those people that you have identified in contact tracing. Now, the enormity of this effort is hard to exaggerate. Dr. Fauci was actually on conference calls with literally hundreds of contact tracers, urging them to be diligent in tracking down every person who had possibly come in contact with someone who's infected. Now, we've never done that before with a highly infectious respiratory virus. And the reason that we haven't done it before is very simple. The flu, which is what COVID-19, the China virus, is basically, it's coronavirus version of the influenza, is so highly transmissible and spreads so quickly because it's airborne that it's impossible to track down everyone who's come in contact with it. Contact tracing is very, very effective, on the other hand, with a sexually transmitted disease, where you actually have to, for example, come in contact with the body fluids of the person involved before you can spread the disease. For example, now we're doing contact tracing with monkeypox, which makes sense. We've always done contact tracing with AIDS and other STDs. But we've never done contact tracing before until Dr. Anthony Fauci's failed venture of doing it with respect to COVID. We've never done contact tracing before for the ordinary flu. Why? Because it doesn't work. A huge waste of energy and resources. The second issue, the second failure, I believe, is a major one as well. We failed during the pandemic to protect the vulnerable. And despite the fact that heroes like Dr. Scott Atlas and Martin Kulldorff of Hillsdale College were advocating from the get-go that the way to prevent deaths during the COVID pandemic was to protect those who were vulnerable, by which we mean those who were of advanced age and those who were immune compromised. That advice was not just ignored by Dr. Fauci. It was absolutely and publicly disparaged as nonsense, total nonsense. That's an exact quote. When the Great Barrington Declaration came out, signed by Martin Kulldorff and others who were experts in public health, advising that we protect the vulnerable, Dr. Fauci simply dismissed the idea. Instead, he went all in to try to shut down the entire population of the United States, even those who were not at high risk of becoming ill, and certainly at very low risk of dying from COVID. So this brings me to the next failure of Dr. Fauci, and that was closing the schools. Now, closing the schools was done in almost every Western country. It was done on the basis of advice from Dr. Fauci and others that schools were hotbeds of transmission for the China virus, and that students and teachers would die in significant numbers unless the schools were closed, and schools closed for a long period of time. There's only one problem with this particular piece of advice, and that is that children are at very low risk of contracting a serious case of COVID. In fact, they're at less risk of dying from COVID than they are from dying from the seasonal flu. We know that for a fact. That was another point made by the Great Barrington Declaration that was immediately dismissed by Dr. Fauci, but it's true. And guess what? We don't close the schools every winter when the seasonal flu hits. We never have. Even though children are at higher risk of becoming seriously ill and dying from the flu, the seasonal influenza, than they are from COVID. And yet we close the schools in case of COVID. There's also the example of Sweden. Sweden was one of the few Western countries that did not close down their schools, did not mandate mask wearing, did not mandate social distancing. They kept society and their economy humming along, and they kept their kids in school throughout the pandemic. The Swedish Health Service, fairly early on in the pandemic, did a cross-cultural comparison between its experience with COVID and the experience of the neighboring country of Norway with COVID. Now, Norway had gone all in to the shutdowns. They had closed their schools, they were masking, they were social distancing, all the rest of the nonsense that went on. And guess what? The infection rates among students, young people in Sweden and Norway, was identical. The death rates among teachers and students in both countries was very, very low. In other words, Sweden did not close down the schools, but did not, contrary to Dr. Fauci's prediction, experience large numbers of deaths among children and among teachers. So the National Education Association, the other groups lobbying for teachers, for the protection of teachers, were absolutely misled when they demanded a year off with pay. Again, a mistake that can be attributed primarily to Dr. Fauci. Finally, there is the issue of natural immunity. Now, we've known about natural immunity since the plague of Anthrax in a couple hundred BC. We were reminded of it again in 165 AD with the Antonine plague. In other words, we've known about natural immunity for thousands of years. We've known that people who contract a disease and recover from it have a natural immunity to contracting the disease again. And we know at the outset of the pandemic that Dr. Anthony Fauci knew that as well, because when he went on Comedy Central, for example, he was asked by the host if people who recovered from COVID would have natural immunity, and he said, well, yes, if this virus behaves like every other virus that we've come in contact with, once you clear the virus from your system, you'll have natural immunity that will protect you from reinfection. Well, he knew that. That's what he was saying in March of 2020, and then when the vaccines came along, he changed his tune. He stopped talking about natural immunity and encouraged everyone who had had the virus, or whether or not they'd had the virus, to get the jab. So he forgot about natural immunity, something that every high school biology student learns about in 10th or 11th grade. That was a big mistake. But I think his primary mistake, what we might call his original pandemic sin, was funding the Chinese labs. Because, as we talked about in an earlier segment, if he hadn't been obsessed with gain-of-function research, if he hadn't been insistent that even after it was banned in the United States that the research continue overseas, if he hadn't indirectly funded the lab through EcoHealth Alliance, the lab in Wuhan, the infamous Wuhan Institute of Virology, then we arguably would not have had the COVID pandemic at all, because Chinese scientists working for the People's Liberation Army would not have been able to move that quickly to develop this, what is arguably a bioweapon. So, Fauci's 5 fatal errors, let's count them up: contact tracing, ignoring natural immunity, failing to protect the vulnerable, closing the schools, and of course the original pandemic sin, funding Chinese labs. And I would say one thing more about closing the schools. American children are now a year or two behind in their studies because the schools were closed and they were forced to try to learn remotely. Learning that didn't remotely come close to them absorbing as much information and knowledge as they would have had they actually been in a physical classroom. And here's the thing. Education is positively related to lifespan. In other words, the more educated you are, the more you know, the longer you tend to live because the better you are able to take care of yourself. And by dumbing down American children for a year or two by closing down the schools, we have arguably shortened the lifespans of American children, much more than they've been shortened by COVID-19, which is to say, not at all. So we've made a lot of mistakes. We have to make sure we don't make these kinds of mistakes again.